Welcome back to Stronger. On today's episode, I'm introducing to you Dr. Gary Goldenberg. Now, Dr. Goldenberg is a friend that I met close to a decade ago on the Muscle and Fitness podcast. Since then, I've become Dr. Goldenberg's client. I go to Dr. Goldenberg regularly for skin assessments and for my skin routine. In this episode, we cover everything from peptides to Botox. I mean, this is literally a masterclass on skincare. Dr. Goldenberg is located on the east side of Manhattan, and I highly recommend everyone checking him out if they are in the city. But I think at the very least, you're going to be able to leave this episode with some great takeaways that you could start implementing into your daily skin routine. Let's go. First off, the Stronger podcast wouldn't be possible if it wasn't for our amazing sponsors. And right now I want to thank Vuori. I tried Vuori a few years ago, started diving into their gear. I was wearing their workout shorts because I have more of an athletic build. And now they have joggers, they have zip ups, they have a whole line of stuff that I really feel like kind of falls into a little bit more of this athleisure line where, you know, you can wear it to the gym, but you could wear it out for, you know, a casual brunch or to go to the store and you actually feel fashionable. So for our listeners, they're offering 20% off your first purchase. Pretty significant. Not only will you receive 20% off your first purchase, but enjoy free shipping on any US orders over $75 and free returns. Get yourself some of the most comfortable and versatile clothing on the planet at vuori.com/stronger. That's VUORI.com/stronger. Exclusions apply. Visit the website for full terms and conditions. Dr. Gary Goldenberg, you and I met through, you heard me on a podcast. I was on Willamed's podcast for Whoop, like 8 years?
A long time.
You reached out to me. You sent me a really friendly DM. And then I think we had you on the Muscle and Fitness Reps podcast.
That was amazing.
That was fun.
That was, you know why? Because I remember growing up, being a kid, and having all those Arnold covers of Muscle and Fitness. And we have a picture of you, me, and who was the guy? Zach.
Yeah, he's great.
The three of us. I looked like a midget. You guys were huge. Okay, in front of this Arnold cover of Muscle and Fitness that I used to idolize. That was amazing. That was such a great experience.
There's something so nostalgic about some of those magazines, even though print now is like dead and it's, you know, when I got asked to be on my first cover, it was like, I think it was at the point where the magazines were really dipping. I could care less. I was just like, just to have that to be able to hang in a frame on my wall.
I remember,
like, this is awesome.
Remember Dorian Yates?
Of course I do. Yeah.
I had his, like that Muscle and Fitness magazine. I think I had it for maybe 10 years. Yeah. And every now and again I would read it. And I'm like, I can't do these exercises. Like, what are these guys doing?
Super high intensity. He would do. It would look like lower volume sets. I saw him train at Bev Francis Powerhouse Gym. I mean, massive. Like one of the greatest bodybuilders ever.
His lats were like a small country.
Massive. But like when you saw how he trained, his feeler sets. When you started adding those up, he probably two really intense sets of incline, but he had to do like 3, 4, 5 sets to be able to do that. So I don't know. I think, great. You know, it became a little bit of a question mark on whether it was really that shorter volume,
right,
higher intent, but he was a beast. And he was the physique, I think, that really changed bodybuilding. That's when things went a little
extreme,
awry, extreme, call it what you want.
It was extreme.
Because you went from this Lee Haney era of like this beautiful thin waist, aesthetically, right. I would say one of the greatest bodybuilders I've ever seen.
To like a tank.
Yeah, I mean, and this wasn't to knock down Dorian, but
right.
it was just freakish.
Yeah, he was not human.
Unbelievable. So we had that Reps podcast, and then we became friends.
That's right.
Both Metallica lovers.
Love metal. Still
okay,
listen to
love metal. Still listen to metal. You became my dermatologist, and I became your coach.
You know, I have to tell you, your
Matching
app, the app is amazing.
I'll take the PR right now.
I love the app.
It's fun.
You know, I was doing your monthly challenges for a while. Like I did 4 or 5. And I said, let me see what else is in this app. And I started scrolling around. And I found this muscle builder program. And I think you put me on something similar maybe 5, 6 years ago. So I started doing it. I love it. It's so easy.
I love the variability because for me, designing programs, it's like a little bit of it's an experience. Like if I'm just training upper lower splits all the time, I feel like I start getting really bored of that.
Stagnation.
Right. So I don't see like, okay, we can do push pull legs. We can go upper lower. we could do full bodies every day. We could do split training, whatever it is.
You know what I love about the app is the videos for the exercise are right there. So like you forget how to do something correctly because it's not about just doing it. You got to do it right. Like, let me see how Don says it needs to be done. Like 30-second video, like, okay, let me just tweak this a little bit. It really makes a difference.
Really is helpful. And I tell people, don't go in there with the mindset of trying to, I guess it's the same there's so many things being thrown at you in reference to your skincare, your health, your hair. It's like there's so many things. You got to start somewhere and you got to start building on that.
Well, every celebrity now is a skincare expert. I don't know if you've seen this, but everyone has a skincare line.
It's crazy.
A makeup line, a hair care line, which is fine. Like they use their platform to promote a brand, to promote a product, which is great. But, we always talk about this. Skincare does not need to be complicated.
Right.
I have patients that come in there on 20 different products. And you ask them what those products are doing, they have no idea. They have no idea. They have no idea. So I like to keep it simple. Simple and basic gets you there probably 99%. It's like that Ron Burgundy thing. It works 60% of the time. It works all the time. Yeah, right, it's kind of like that. I think for skincare, you basically have a few labs that are very good at formulating. And then they give you options of what it is that you want, right? And you put it together to what you think is appropriate. For me, it was all about, can I care for all my patients with what I have to offer for them? That's how we kind of approached it. So I'll give you a perfect example. I used to make a neck cream, okay? And if you ever buy a neck cream or an eye cream, what you'll notice is you get about half to 25% of a regular tube for about double the price. But if you actually look at the ingredients, they're extremely similar.
Is it just a little thicker?
It's maybe a little thicker. Yeah. Maybe it has a little bit of a different scent to it. But all skincare, especially creams, they're either water-based or they're oil-based. Those are the two things.
It's amazing how the packaging.
That's it.
You told me eye creams are like, it's like the same. I have one. I use it. It's just like, I just think of it as like different moisturizer, but it's almost, there's something about the little tiny, it's like here. Yep. I did it this morning. You feel like you're hydrating a little bit more.
Look, this is what I tell patients. If using a product which is safe and effective makes you feel better about your skin, about yourself, because it's all about the experience, by all means, go ahead and use it. But if you want to use your regular moisturizer, that's also okay.
Right.
There is no wrong way of doing it. The only wrong way is doing nothing. When somebody comes in and I ask them, what are you doing for skincare? And they're like, I don't know. I'm like, okay, nothing is not appropriate. We need to do something. And you kind of build from there.
A lot of the principles of working with a male or a female in my business are very similar. I mean, for years and still now, there's a little bit of a tug of war. But now suddenly women are like embracing strength training, where 15, 20 years ago, 25, 26 years ago, the first thing I would hear out of most women's mouth is, I don't want to get bigger. I'm like, we're not going to get you bigger. We're going to get you stronger. Do you feel like in your industry, that's very similar when it comes down to skincare?
So I think women are more likely to use more products.
Sure.
It's like, if you ask a guy, most guys say, I wash my face with my shampoo. That's basically what they do. Okay.
That's disgusting.
And they might also use shampoo as their body wash. They just want to use one product.
Like one of those 3-in-1.
Yeah, it's like they want to have one product, has shampoo, conditioner, and a body wash all in one tube.
The only time I've ever done that is when I'll tell you, I've gone to like hockey rinks in like Montreal or Nashville, and you have to shower and you're like, oh my God, and suddenly some buddy pulls out a tube and you're like, all right, let's do it.
Yeah.
It's kind of gross.
But so I think now things have changed, and I believe in simplicity, because simplicity leads to higher compliance.
Right.
Because the more complicated something is, it's probably the same with training. People are just not going to get started. So I think from that perspective, I think it's very similar for men and women. What's interesting, if you look at other cosmetic procedures like Botox and fillers, which is so popular, right? Mm-hmm. It used to be that certain locations were taboo for men and certain locations were taboo for women. Like women would never want a stronger jawline. 10 years ago, something flipped. Every single woman wants a stronger, more chiseled jawline. That was always considered a male kind of a procedure.
Women are saying that to you when they come in?
If you look at magazines, you look at what's popular, you look at celebrities, you see a chiseled jawline, okay? Men used to never want to have a lift in their cheekbones. Now I'm doing it routinely to give him kind of that Clint Eastwood-esque strong cheekbone look, And then the other crossover that I've seen is hair loss. 10 years ago, 80% of my patients were men. You know, everyone knows guys lose their hair, they go bald, they want to do something to preserve it. You know, almost exclusively male patients. Now, I would say it's more women that are losing their hair, and I'm seeing more and more women in the office for hair loss than men.
Why is it suddenly now this is happening? Why?
I think the if you look at the percent of women that suffer from hair loss, it's been trending up. Whether it's nutrition, whether it's hormones, whether it's environmental. You know, you've heard of COVID hair loss. And now what I see a lot of is from GLP-1s.
Wow.
There was just a study that came out that GLP-1s can cause hair loss. And it's because rapid weight loss can cause your hair to shed. We've known this forever. It's called telogen effluvium. Mm-hmm. That's usually temporary, or sometimes it can be chronic. You have nutritional deficiencies because people are not eating.
Yeah, they're not eating.
They're not absorbing what they're eating. So you got some nutritional deficiencies. And then there was a recent study that showed basically that GLPs can actually change your hormones, which makes sense because you're losing weight quite rapidly. So your hormones are going to change, and women are much more sensitive to hormonal hair loss than men are. So there is a little bit of crossover. And, you know, that's one of the things that is interesting about medicine. It's never stagnant. There's always something new, so you always have to be thinking outside the box sometimes.
All right, so most women are going to have more, or going to take more products than men, and this isn't. I think statistically, it's probably pretty accurate.
They like to try different products.
I still like to. I mean, your products are what I use all the time, but sometimes I'll run out, right? And it's. You know, I don't want to bother you, or, you know I have to get something on the spot. I mean, I might go buy like some cheap Cetaphil or something, but I definitely...
It's a good product. Yeah. Cetaphil's a good product.
Yeah, it's just like a very gentle cleanser, but like all in all, your enzyme cleanser, which is your 1 to 2 time a day cleanser that you would use.
So if you think about skincare, you need 4 things. That's what I always talk about. You need a cleanser because you need to wash your face twice a day. Morning and night, you should wash your face. Everyone should use sunscreen every morning. SPF 30 and higher is a must, okay? So that's your morning routine. Can you wash your face and put on sunscreen?
Easy.
Takes 30 seconds, okay? At night, you wash your face again. All the pollution, dirt, everything you're exposed to, sweat, you got to wash your face before you go to bed. You want to use a retinol. Retinol has the most scientific data of any quote-unquote anti-aging product that there is, other than sunscreen. Sunscreen is the most anti-aging, but retinol is the most when it comes to a night cream. It's vitamin A derivative. It helps your skin to turn over better. It gets rid of the dead skin layer, and your skin looks fresh, helps with acne, pores, pigmentation. It's a wonderful product. So everyone should use a retinol at night and then lock it in with a moisturizer. Those are your 4 things. Now, if you want to add something else, if you want to add a toner or an astringent, another moisturizer, something thicker.
Toners are mainly just, is it like normalizing your skin? Is it like pulling out a lot of the oils?
It's essentially to get rid of your oil. It's more alcohol based.
Right.
So for those that have very oily skin, sometimes it's helpful. Here's what people don't understand. Just because you have oily skin, it doesn't mean that you don't need to moisturize. And it doesn't mean that your skin should be dry, because what happens if you don't moisturize and you always try to dry your skin out, your skin will naturally compensate by doing what? It's going to make more oil.
More oil, yeah.
You know? So you have to normalize the skin barrier, and you have to use a product or a combination of products that actually will help to normalize your skin. And the other thing that frustrates patients is, like, in the summer, you may need a different routine than in the winter, especially in a temperate climate.
I've totally noticed that.
You know? And then as you age, your skin's going to dry. That's a normal part of aging. And if your skin is drying, you need to add more moisture to it. And then the other thing, which, you know, when I was a dermatology resident, people always said it didn't make a difference. You got to drink water.
Oh my God.
Like, people who don't hydrate, like, I don't understand how hydration is not part of your normal skincare routine.
I get asked all the time, is there, what's the most important thing? And a lot of coaches don't like to answer that question. And I'm like, I think hydration is the one non-negotiable. We're going to have a bad night's sleep here and there. You're going to go out late. You might go party. One night's not going to kill you. I don't think you should ever be dehydrated. I don't think it's something where even one day is like acceptable. Like, so when these publications have been turning around lately and they're trying to empower people and they're saying, oh, Nothing is non-negotiable. No, hydration is non-negotiable.
non-negotiable.
Let me be very clear here. That's the one area where if someone's dehydrated, let's fix that first.
You know, my kids make fun of me because I got all these like dad expressions like pain is weakness leaving your body, one of those things. Yeah. And I always say, if you're thirsty, you're already dehydrated.
Yeah.
You should never feel thirsty.
Yeah, you should never feel thirsty. And then getting into things about trace minerals. And, I was listening to some interesting podcasts lately on salt. I mean, we obviously the importance of that. But, there was an era where low sodium diets. I was listening to Dr. James D. Nicolantonio talking about, he was recommending, I think, 3,000 milligrams a day as like the minimum. And when you sweat, you are losing so many trace minerals. So you work out, I sauna, you're on the street walking, winter, summer, it doesn't matter. You're burning it.
Plus it tastes good.
It does.
Salt
your food.
Yeah, salt your food.
Yeah,
it's not going to kill you. Look, unless you have super high blood pressure and your kidneys are not working, because it's all about whether or not your kidneys can filter it out. If you have normal kidney function, which hydration is very important for, you go out, you want to eat a steak, you want to put some salt and pepper on it. It's the only way to do it. When I talk to patients, a lot of times I'll put them on what's called an anti-inflammatory diet. And if you Google or use Grok or chat what an anti-inflammatory diet is, it's not well defined.
Right.
So what I tell my patients that have conditions like eczema or psoriasis or acne, anything where there's inflammation, is no refined sugar. Okay. If you're going to have meat products, try to have organic, something that doesn't have hormones. And dairy milk, it's clear now it's better than some of the non-dairy milks. And white flour is probably like the worst thing that you could have. Just anything that's refined.
Pretty simple though.
Yeah, pretty simple.
Yeah.
And just like make sure you get a lot of protein. Make sure your diet is colorful, because if you're eating different vegetables and fruits, you're going to have a lot of color in your diet. The red, the green, purple, whatever it is. And just eat food that's whole food. Not Whole Foods, not the store, but whole food. Steak, fish, chicken, rice, things that are actually from nature and not refined or processed. Nutrition is key for skin health.
Yep.
Just like it's key to your general health. You are what you eat. If you have a bad diet, and we see this, a good example is psoriasis, which is an inflammatory skin condition. Obesity is rampant in patients with psoriasis because we know that white fat, that's the fat around the abdomen, is pro-inflammatory. That's why losing weight actually helps with some of the skin conditions. So, the question always is, what came first? Is it the chicken or the egg?
Right.
And the truth is probably they came together because they are both feeding that cycle of inflammation, because inflammation makes more inflammation, and then you get more and more on top of it. So some of the medications help, but diet and lifestyle, is the hardest thing for somebody to change. It's much easier to take a shot or a pill. What's really hard is to change behavior, but that's what really needs to happen.
So the Stronger podcast is not possible if it weren't for our sponsors. I want to really thank Cozy Earth. They've been one of our really consistent ones. And to be honest, I've been using their bamboo sheets. My wife uses their pajamas, and my dog Sambuca has been using that big, what is it? It's the big blanket. It's the bubble cuddle blanket, which actually, Sierra, is the exact same fur color as my dog Sambuca. So I have this 8-pound dog laying on this blanket because my wife is freezing cold because I like the room at 65 degrees. So she's underneath the blanket. And the other day I went to grab the blanket and I couldn't see Sambuca on it. But he's literally camouflaged in there. So if my dog Sambuca likes it, this is very comfortable. And now my wife won't even let me use it because her and Sambuca are cuddling together on it. And I use the bamboo sheets, which are nice because it's very cooling, which is what I want. But really has improved my sleep quality as well, according to my Aura. I could tell my body temperature is at a normal. Sierra's just laughing right now. This is not like this. This is an ad, but this is real. You understand what I'm saying? So I'm a big fan. I'm a big fan of Cozy Earth. Black Friday has come early at Cozy Earth. Right now, you can stack my code STRONGER on top of their site-wide sale, giving you up to 40% off in savings. That's incredible. That's CozyEarth.com. Code STRONGER for up to 40% off in savings. These deals won't last, so start your holiday shopping today. And if you get a post-purchase survey, be sure to mention you heard about Cozy Earth right here from me I truly use this product. So let me know what you guys think in the comments section of our post, because we're always tagging Cozy Earth and our brand sponsors. So I'd love to hear it. If you guys like it, let us know. Now, pivoting from the skincare routine, which I love the simplicity of what you do. I love your products. So we're going to give information on where people can find that stuff. But skin maintenance. So you started introducing me to lasers, things that I started coming in and doing. I actually did try Botox with you once or twice. I was kind of really nervous about it. You pushed me to doing it probably a couple years ago. And I was more impressed from what you said from a preventative standpoint.
Pre-tox.
Right. So what I was, and I actually haven't done it in a while.
It's been a while.
It's been a while. It's time.
I should have brought some with me.
Yeah, I would have loved it. Right? You could have done it here. But I think initially I thought of it as more of a vanity thing, which is why I would staying away from it. You presented to me as more of a preservation thing. And I think that changed my way. Now, I don't want my face frozen. I want my forehead to be able to move. I want you to see expressions on my face. But what you presented more from a preserving standpoint. Can you explain that?
Yeah, look, so I tell patients that my forehead has not moved since 2003. Okay, I've had no movement in my face since 2003.
Right.
And basically the lines of that you get on your skin from moving the muscles underneath are like a wrinkle in your shirt. The more you move, that particular area, the deeper that wrinkle is going to get, and the harder it is going to be to iron it out.
Right.
So when somebody says, "Oh, I'm 45 years old, I'm too young for Botox," it's not correct if they're going to be interested in 55. Some people are never going to care, and that's fine. That's okay. But when you're 55 and you want to look better, it's going to be much harder to get that line to be less visible if it's so deep. So Botox doesn't only make you look better now, it also prevents you from looking worse down the road. And that's why I think, somebody asked me, should I get Botox? My answer is always yes.
Right.
You don't have to look like a crazy person.
Right.
Okay. You can still have a natural look, and men and women do want a different look, especially when it comes to their eyebrows. You can still look like a normal person. All you're doing is you're slowing down that process of aging on your skin. And it just becomes one of the parts of your normal routine. It lasts about 3 months, and most people come in 3 to 4 times a year, and they get a treatment.
It's super quick.
It's super quick.
Easy.
It's completely painless.
Yeah, you don't feel anything.
You don't feel it. And in 2 weeks, your skin looks much better.
Right.
And we can dial it up or dial it down depending on your aesthetic. Some people want to be frozen completely, and some people still want to have some mobility.
Right.
And more people are moving towards that natural look.
Yeah.
Because, we all remember those, quote unquote, those women from Fifth Avenue, which is not the case anymore.
I think they've ruined it for a lot of people.
They've ruined it for a lot of people.
And you're seeing it in Hollywood now. You're starting to see more of that natural look come
Correct.
back.
Exactly.
What's her? Pamela Anderson was one of them recently that I really kind of tipped my cap to, because she came out no makeup. This was like, I think, woman in the late 90s or early 2000s? Yeah. I mean, she was probably, I think, the sex symbol of on the planet.
Too much.
Yeah, it was too
much.
She was gorgeous, right?
Right.
Like, let's be very clear here and honest. But I think I really respected how she went back to this natural look. And you're starting to see red carpet activity going on.
Especially in New York City, everything here is understated. It's that quiet luxury thing, you know? You want to get work done, but you don't want to look so overdone, which on the West Coast is still very popular. I was just in Dubai, where I partner with a clinic there. I've gone there a few times a year to see patients. And there you're starting to see people get less and less overdone. They want to be a little bit more understated. They want to look more natural. So I think Botox is a part of that. You talked about laser. Laser is a great way for a great treatment. There are different modalities you can use to make your skin look good, so you don't need to wear a ton of makeup.
And there's no long-term issues with doing any of these things.
It only makes your skin look better.
Right.
It doesn't make it look worse. So like Botox is the most popular and the most prevalent cosmetic procedure in the world. There've been literally like hundreds of millions of patients have been treated, hundreds of millions of times. And in the right hands, you gotta do it the right way. It's very safe. And all the disasters people read about are usually from somebody who, they try to go a cheaper route, right? You get what you pay for. And, it's, they get a side effect. The nice thing about it is, it goes away. So if something happens, let's say, somebody drops your eyebrows or whatever.
What does that mean?
It goes away. If they put too much in the forehead, the eyebrows can actually drop.
Oh, wow.
Yeah, so you have to go to somebody who's experienced and knows the anatomy and can do it the right way. So, be careful who you choose to do your procedures, because you want somebody who's board certified and somebody who's experienced. And, the best thing always is to get a referral from somebody you know. Always.
So Botox, you covered, lasers, microdermabrasions. These are all those are basic things that are more about long-term health and long-term preservation.
Skin health.
Right. How often now are these more? They sound more like luxuries. Do you think it's going to come to a point where most people are going to be doing this as like, going to the dentist and different, because obviously
Sure.
that's hygiene and that's very
look,
different.
A lot of these businesses are getting commoditized because you're seeing more and more people doing it. But it is a little bit of a pampering, right? Because you're paying out of pocket. You want to have a nice experience. You want to go somewhere where you're going to be treated well. Mm-hmm. So yes, it is a luxury for most patients, and for a lot of people, it just becomes part of their routine.
Regimen. Right.
Yeah, look, it's like going to a nice gym. You don't need to go to a nice gym, but it's nice. It's nice to be there. You could go to a cheaper gym where everything is rusted. It's a different experience.
Much different. So all right. So we did skincare. We jumped into hair. That's one of the most important, I think, that we haven't covered.
Huge. Hair is huge. I mean, look, I think it's important to separate men and women. I think for some reason our society has decided that it's acceptable for men to lose their hair, but it's not acceptable for women. So when a woman starts shedding excessively or losing their hair and they start seeing scalp and their hair's coming out in clumps, it's literally like an emergency, because they're, mentally and psychologically, they're very distraught. And there are things that you can do, and you got to work from the outside in and from the inside out, because a lot of times it'll be a nutritional deficiency, like they're very low in iron because they're not eating or not absorbing iron in their diet. Or it's a hormonal imbalance because they just had a baby, or they're perimenopausal, or they're going through menopause. So you got to fix the hormonal imbalance. Those are very important.
But those aren't always things that a general practitioner is going to be able to pick up on. I mean, very
not
rare.
Always.
Right.
Not
so
always.
I mean, now you're getting more into functional medicine, aren't you?
Well, I work with, an OBGYN, an endocrinologist who I trust, who I know are excellent at their craft. And if I suspect that there is an issue, I usually refer them out for a complete workup, because what I can do for screening labs is going to be different than somebody whose job really is just focus on hormones, okay? So that's very important. And then there are treatments that you can do from the outside in. So things like red light, they actually help some. I know we talked about that. I think that there's some supplements that can help. Taking, for example, biotin or some things that block dihydrotestosterone. This is both for men and women. There's some topicals like minoxidil that help. Mm-hmm. These are all things you can do at home. And then there are procedures, regenerative procedures, which have very good data, but are not necessarily FDA approved for treatment of hair loss. So the two that I use all the time are going to be PRP or plasma, which like every athlete knows about, because a lot of them get it in their joints.
PRP stands for platelet-rich plasma.
Platelet-rich plasma. So what happens is we draw your blood, we separate the plasma from the red cells and the white cells, and then we separate rich from poor plasma, and then we actually inject it back into the scalp. It's a regenerative treatment. It's agnostic to the area that you're treating, because we also use it for skincare and for making collagen. So it's like a pharmacy. So whatever the problem is, if you put it in that area where there's a problem, it helps the area heal. And it does it naturally because we're using your own body's healing potential to help you with whatever problem you have.
There's so many peptides now, right? Like,
yes.
Is there anything for hair loss?
So I did try using peptides. I don't think the data is quite compelling enough right now.
Okay.
But I did see some efficacy in some patients. In my hands, I think what works really well is plasma or PRP, and now I'm using mostly exosomes. So I'm using stem cells. I used to use stem cells from umbilical cords of, like a woman would have a C-section. They would take the umbilical cord, purify stem cells and sell them. So I used to use that. And now we've moved down to exosomes, which are a byproduct of stem cells, which are basically helpful in repairing damaged tissue.
The stem cells, you weren't able to do that in the States, right? I mean, you had
there was a little pause. The FDA gave us a little pause where we were able to do it. I know some people still do it, but I stopped using them when that pause ended. And actually now what I use plant-based exosomes. So it turns out if you look at evolution, we have some similarities with
Can you explain that? Can you explain what an exosome is?
So exosomes are essentially a byproduct of stem cells. They are a package. They're like a plastic bag, if you wish, that has stuff inside. And the stuff that's inside varies, but usually it helps tissue repair. So if you have one cell next to a different cell, and one cell is damaged and the other cell is healthy, the healthy cell will actually send the damaged cell some stuff to repair itself in an exosome. Exosome is just an envelope. Okay, it's like a container, if you wish. So I use these plant-based exosomes, which are very safe because they're made in a lab. They're not from another human, so you're not going to get a disease. And what I do is I use them with a procedure called microneedling, because microneedling your scalp actually puts your hair follicles in a growth phase.
So what is that exactly? It's ejecting. It's like a
So I'm microneedling, which is like a roto-rooter, if you wish, that literally at a very high rate oscillates and makes little holes in your skin.
But like so minuscule, right?
Half a millimeter to 0.75 millimeters, maybe 1 millimeter. So think about your ruler from like high school.
Yeah.
You could hardly see, right? Yeah. But that's enough to stimulate hair follicles to grow. And then we'll layer the exosomes on top so the skin just kind of sucks them up.
Absorbs it. How many treatments would you have to do on that?
So what most people do is they do a treatment once a month for 3 to 4 months. And then we usually wait 2 to 3 months because your hair is on a 3 to 6 month cycle. So it'll take 6 months, let's say, to see if it's working for you. And I would say the majority of the time, nothing works 100%.
Right.
Majority of the time, we'll either be able to stop or slow down the process of hair loss. And then I would say, depending on where somebody is when they come in, the later they are, the worse it works, right? Earlier is always better. If they come in, it's early in the process, I would say 80% of the time we're seeing regrowth, meaning that we can bring some of the follicles back. So it's a pretty good treatment. It's less invasive than a transplant.
Like, is there like a maintenance protocol that they have to follow at that point?
2 to 4 times a year.
Huh.
Because again, your hair, cycles every 3 to 6 months. And it's going to vary from patient to patient, and it's going to vary within the same patient from year to year.
So what about we're trying to talk to young adults about skincare, preventative, like just using moisturizers is very important. Are there things that, a young 30-year-old who hasn't lost his hair yet that, someone, his father, his grandfather, they have no hair. He knows it's coming, but he hasn't lost it. Are there things that he can do or she can do that's more preventative at a young age that's safe?
Yeah. So look, hair loss is definitely genetic, right? What I mean by hair loss is androgenetic or male pattern or female pattern hair loss. And you could have siblings with the same DNA, and then some people that gene gets turned on. That's called epigenetics. That's what controls sort of what goes with your genes. So you got unlucky, that gene got turned on. You're going to know by 30 if you're receding. Okay, you're going to see, by temporal, but around the temples if you're receding. You might see it on the back of your scalp. So you're going to know. The easiest thing to do is to go to the pharmacy and buy some Rogaine or minoxidil. It's the generic, right? It's over the counter. It's very safe. It's effective. It keeps the hair growing, and it kind of helps it not to fall out. Now, some people are like, okay, I want to do everything because I don't want to lose my hair ever. And that's when they come in and we do those treatments that I talked about. And, I've treated patients as young as 16.
Wow.
Yeah, because some people have bad genes, and as old as in their 80s because they want to keep their hair.
I'm shocked that a 16-year-old would actually think that far ahead. At 16 years old, I was invincible. I didn't think I was going to ever lose.
But if you were losing your hair at 16...
Yeah.
And you're like, oh my God, what is going on?
Is that the youngest age that you've seen someone lose their hair?
For androgenetic, yes. 16, 15 is probably, I've seen a few cases where people were almost balding at that age. And that's just a function of their genetic, makeup.
So now specific modalities like red light, right? When you and I spoke about it last time, you were more of like, well, there's not enough research pointing in the direction, but I heard you bring it up today about about your hair.
For hair loss, there's actually some studies that show that red light decreases local dihydrotestosterone levels. Now, if you're losing your hair and all you're doing is red light, you're gonna lose your hair. You're gonna lose it, yeah. It's essentially a tool in your tool belt. So if you look at all the modalities together, I always tell patients with hair loss, you got to throw everything in the kitchen sink, because once those follicles are gone, that's it. They're not coming back. Okay, so you don't want to lose them, because if you lose them, you can't bring them back. So you want to use every single modality at your disposal to try to keep as many of them as you possibly can.
What's going on with these surgeries now? So you're hearing people having like hair transplant surgeries now. I mean, it's been going on for a while, but that to me has always sounded scary. Where are they taking hair from to go, like, what, how does this work?
So look, I think there's a lot of videos on social media about people, going to Turkey with like no hair and coming back with hair.
Like full head of hair.
Exactly.
It's crazy.
So the truth is that hair transplant's been a thing for a long time.
Yeah.
For decades. And it is getting better. So the hair on the back of your scalp does not have the same receptors to dihydrotestosterone as it does on the crown. So people who go bald usually keep the sides and the back, right? Mm-hmm. So if they have enough follicles on the back of the scalp, they'll take some of those follicles and move them to the top. And it is getting better to where the results are better, but it is still surgery. It's very expensive if you do it here in US. And, it still does not quite look as good as the original.
Right, but is it like, but your hair is not growing. It's just like
growing. No, it's growing.
It is. Yeah. So it's not like a rug.
No. They take a follicle that's growing from the back of the head.
So they actually have to go get their hair cut at that point.
Well, yeah. It looks, for sure. There are people that that probably have had a hair transplant that you wouldn't know about. Yeah. They just never told you. Yeah. It's very, very prevalent.
Liars.
It works better. It's still better for men, because when men lose their hair, it's in a more defined pattern. So it's easier to fill in. Whereas with women, it's more of a diffuse pattern. So it makes it a little bit more difficult. But, both men and women can get a transplant.
Talk to me about something that no one really discusses much, but like shampoo and conditioners. Where, using these cleaning agents in our hair, certain people, you see them going more of this all natural. Like I saw some guy the other day, like rubbing bananas at his head. I'm like, that looks a little extreme. Don't really know if it's doing the same.
Bananas are better for eating.
Yeah, exactly. But you get what I'm saying here.
Yes.
Like, what are we? I'm also a believer. Like, listen, we expose ourselves to soaps and perfume and maybe non-filtered water and really crappy skin creams that maybe have other things in it, not like yours, right? And we're constantly exposing ourselves to toothpaste with specific ingredients in it that might not be healthy. Granted, we want to be clean.
Sure. We
want to have fresh breath. Like, what's your thought process?
Yeah, look, I think shampoo and conditioner is very important. Now, a lot of people think that that's what causes hair loss or can bring their hair back, and it's just not true, because both shampoo and conditioner are for the outside of your hair.
Right.
Hair loss is caused by a problem in the follicle, which is deep inside your skin. Mm-hmm. So, for me, shampoo and conditioner, unless you have a condition like seborrhea or dandruff or psoriasis, some kind of a medical condition, I tell patients, use what you like.
Right.
There's some shampoos and conditioners that you love the smell or you don't want to smell. You love the way they lather or you don't like the way it lathers. And I think most men end up washing their hair probably every day or every other day. And most women do it probably 2 to 3 times a week,
right?
Especially if they have longer hair.
Right.
And I think that's fine. As long as you're not doing something excessive and you're not going crazy, there's so much information now that you don't know what the truth is. And, these are cosmetic products, so no one's going to do a medical study to show whether or not it's something that's valid. But if you have a real medical condition, you need a medicated shampoo. That's what I'll say.
Mm-hmm. Sun exposure. We have to jump in.
Don't do it.
I know. So you already jumped into the SPF 30 or more for your face. You've created a great product where the SPF's actually mixed into the moisturizer, which I use. I don't like the idea of putting on a moisturizer than putting on an SPF out. It just, for some reason, I like it mixed in. I've heard certain people, it's not going to be as strong as I think that's all bullshit.
It's okay for daily use.
Yeah.
If you're going to the beach,
you need
want to
something a
use
little heavier.
a heavier sunscreen. But if you're just, driving around, walking around, moisturizer with sunscreen is fine.
Now, the sun. Hawaiians, they're out there surfing all the time, and people are exposed to the sun, and I see him live a long life. One of my close buddies, he's, in his 50s, he's got perfect skin, he's in the sun all the time. Do we respond to it differently? Is it just something that you need to stay away from? Is a little bit of sunlight on your body a good thing? How do you...
So look, I think it depends on the person, right? If you're from Northern Europe and you're what's called Fitzpatrick skin type 1, which is as light as you can get, your skin is going to respond to the sun different than if you're from sub-Saharan Africa. Okay? Just evolutionary, people in the Northern Hemisphere were never exposed to as much sun, right? Because of the, where they live. So what's 100%? We know 100% that UV causes skin cancer, including melanoma, which is deadly, and causes pigmentation on your skin, and is one of the culprits for skin aging. Indisputable evidence proven over and over and over again. Where the debate gets a little kind of controversial is the vitamin D issue, because we know that so many people have vitamin D deficiency. So, a few years ago, I checked my vitamin D and it was very low. I started taking a supplement. I think you sent it to me. Mm-hmm. I started taking a supplement and it went up to a very normal level. It doesn't mean that I have to go and get a sunburn, okay? But I'm also not one of these like crazy people that say like you can never get any sun.
Right.
So what I always tell patients, look, if you're going to be out early, check the UV index. If the UV index is not high, put on a thin layer of sunscreen. There's an app for that, or your phone has.
What's a good range? I know my kids showed me that they were checking it out the other day, but I wanted to tell you.
So if it's moderate or below, you can, in my mind, you can get 30 minutes of unopposed UV early in the morning. Okay, 7, 8 a.m. You want to go for a walk. You don't want to put on sunscreen, wear a hat. I'm okay with that.
Okay,
but if it's noon, you don't want to go lie around and fry and getting a tan. There's no such thing as a healthy tan. You probably, we grew up in the same time. Everyone got a base tan. Do you remember that? You had to get a sunburn before you went to the beach.
Yeah.
In retrospect, that's like the dumbest thing
ever
that you could ever do. You're
People
basically
would be going to the tanning
blasting
beds.
yourself with radiation before you went and got more radiation.
You would go to the tanning beds.
Yeah.
And you'd spend not the full 15 or 20. You'd go in for 5
2
or
minutes,
7 or
a base.
Just to kind of base, because you don't want to fry.
The worst, so stupid. Look, the American Academy of Dermatology, which is our largest national professional group. So I chaired the skin cancer screening committee. Okay. And we actually, on Randall's Island, we screened firefighters. Okay. And it was so cool. I took my son with me, he got a tour of a fire truck. It was the best thing.
Yeah.
But the exposure to radiation, UV radiation, and firefighters actually are at a higher risk because they're exposed to chemicals when there is a fire, and actually increases the risk of skin cancer, even though it's not from the sun. But the number of things that we found on these men and women was just crazy, So what I'll say about the sun and UV debate is that try to protect yourself as much as you can. Don't be crazy, but make sure that you're staying safe. And everyone should have a skin cancer screening once a year. Get somebody to look at your spots once a year, because you know what? That 15, 20, 30-minute visit easily can save your life sometimes.
I think that's something that I started doing with you years ago, and we do it more than once a year, because I'll come in to see you maybe 2-3 times a year. I'd say on average. It's been a little bit longer.
You haven't been in
the last couple months, but we're gonna get them in maybe the next 2 weeks if you're cool with it. But you will. There's a specific device. I've got some moles on my body. Can you explain that? And we've actually had to have some biopsy.
Yeah.
It really gives you some peace of mind.
I use 2 devices. One is called a dermatoscope, which is, people call it a magnifier, but it's not truly a magnifier. It just gets you a closer look at the spots in a different way. And there's a specific training that one has to have. And then I use another device called Nevisense, which uses essentially current. It's an AI device. It uses current to predict, and it does it with about a 99% accuracy, whether a spot is more likely to be benign or malignant. So if I'm not sure, if it doesn't look totally normal, but maybe not so bad that I need to remove it, Sometimes I'll use it to get that extra information. Information is key here, so you want to try to get as much info as possible. And look, if something looks atypical, we do a biopsy, we send it off to the lab, and then a week or two later, you get a diagnosis that says, okay, yes, it needs to go, or it's okay to just watch it.
It's fantastic. I think that's something that everyone should be doing.
It's part of your normal health maintenance.
Is that typically, but that treatment there, even though that would not be covered by insurance, right?
Some plans actually pay for it.
Yeah?
Yeah, they've come around.
That's fantastic. I wanted to ask you also about deodorants. All right. So specific, aluminum-free deodorants. Like, what is it? Does it really make a difference? It's
another controversial topic.
Exactly. That's why I'm asking you. I want to get, my thing is this. I want to get your opinion. Like,
sure.
The people I'm bringing in, even if the research, like for instance, red light, I understand maybe all the data is not 100% conclusive. I want to get your opinion. So when it comes to something like deodorants, what's your thought?
So look, I think that some people are okay with using aluminum. I certainly use a regular deodorant, antiperspirant. I think it's fine because you're not rubbing it all over your body 24/7. So I think probably only trace. If it enters your body, it's a trace amount. There's some people who say, look, I will never use an aluminum deodorant. And that's also okay with me. As long as you find a product that you like, totally fine.
You don't smell.
Where it becomes an issue
right.
is that some people become allergic to their deodorant. So very often they'll come in and their axilla, which is the medical term for armpits, are inflamed. They have blisters, inflammation. It's very painful and uncomfortable. So that's actually quite common that people can become allergic. Now, we talked about Botox earlier. You know what's great is Botox in your armpits.
I heard this.
Because it actually stops you from sweating for 3 to 6 months. It's a medical condition called hyperhidrosis, where people are basically like sitting around in a room like this where it's cool, and they're just profusely sweating. It's a medical condition. And then there's some people who just don't want to schwitz, they don't want to sweat so much. And for both of those, Botox in the armpits is like a life changer.
Interesting. Hey, Chris, how are we doing? Are we ready for the questions?
Yep, I am here and we are ready. So Don and Dr. Goldenberg, we have a live caller today and it's Sophie. So I'm going to go ahead and let her in.
Hey, Sophie, how you doing?
Hi, so nice to meet you both.
Nice to meet you. Where are you from?
Originally, I'm from the East Coast outside DC, but I live in Los Angeles. So I have a couple questions. Am I allowed to ask two?
Please.
So my first question is pretty simple. I have teeth grinding issue, and so I got masseter Botox in my jaw. And I was curious, I've heard a lot of different things about how regularly you should get it. My dentist said one thing, and my dermatologist said another thing. What do you think is the appropriate amount of time between sessions to get masseter Botox?
So Botox lasts for about 3 months. It's agnostic to which muscle you're injecting. But what I'll say is that some patients don't need it every 3 months. So when you feel like you're starting to grind your teeth again, you go get another injection. Until that happens, I think you're good.
And it still takes 2 weeks roughly wherever you're injecting
2 weeks. Yeah, 2 weeks for maximum results.
Right.
And I think that's a great treatment, not only for medical use like grinding or clenching. For a lot of people that have very strong muscles, the masseter muscles are the muscles you use to chew. They all actually bulge out and it makes their face look more round as opposed to more sculpted. So sometimes I'll inject Botox into those muscles to make the face actually more sculpted, not necessarily for grinding. And then the patient will come back and say, I don't get headaches anymore.
Wow.
I used to wake up with jaw pain, could never place why it happened, because a lot of people, are grinders and clenchers.
Wow. Interesting.
That was me.
There you go.
It saved me so much physical pain.
And it's bad for your teeth. It's horrible for your teeth.
Yeah, I know. My dentist was like, because I would always spit my mouth guard out, so I had to do something else.
They gave me a mouth guard once. I hated it.
I can't
I know,
oh
it
my
wasn't
God.
for me.
Miserable.
But masseter Botox really helped.
That's good to know.
My second question is not Botox related, but I would love to get the lowdown on what the good lasers are so that I'm 38 and I really do a lot to take care of my skin, but I know I could be doing more. So what should I know?
So, every company essentially makes very similar products. There are all these laser companies and they all have, the same technology or similar technology, just in different boxes. So the way you think about laser is that the less downtime, the less effect. Doesn't mean you shouldn't get it. It just means you have to have realistic expectations. So if you have a laser, let's say, like I love this device I have called Laser Genesis. It's a 1064 nanometer laser. It's a lunchtime laser. I think that's the one we did.
That's used on me, yeah.
You know, it makes your skin glow.
It's awesome.
It refreshes it. It doesn't hurt. It's quick, and you don't need downtime. There's no downtime. You walk out, you go right back to work. Now that's different than doing something like CO2 resurfacing, where I'm taking off half of your skin surface.
Ooh.
And then it's highly effective. It's probably the best for making collagen. It's great for pigmentation and wrinkles and lines, but you can't leave your house for 5 days. So and then there's multiple procedures in between. So that's the way I would kind of think about it. You know, when you talk to your dermatologist to say, okay, the downtime is directly related to how much effect you're going to have. So like Laser Genesis is a great device, but you're not going to get the same level of result as you would from a CO2 resurfacing. Just impossible.
Do you ever do the CO2 resurfacing?
All the time.
Really?
Yeah. It's very popular.
Does it affect you that much? Do you literally feel like for 5 days?
Yeah. For 5 days, you're basically sitting at home. You're washing your skin 5, 6 times, 7 times a day, and you're putting Aquaphor 5, 6, 7 times a day. You know, you really want to, make sure that your skin stays healthy. But then what happens is your skin gets tighter because you're making collagen. You get rid of a lot of the etched in wrinkles and lines. Pigmentation, it works great for. But, you got to be able to take the time, and that's basically it. So that's how you should think about lasers. So they're all effective in the right hands, right? But it just depends on what your goals are.
Perfect. That's very helpful. Thank you.
Awesome. Well, listen, it was great meeting you.
Yeah, nice to meet you too. Thank you.
Take care. Bye-bye. All right, man. So that was a good... We could have kept going. I can't thank you enough. I know you got a family, impressive practice up on 75th between Madison and 5th, is it?
75th and 5th and Madison.
5th and Madison. And I'm grateful. And it's really awesome. I never expected that when you slid into my DMs 8 years ago. I didn't expect me and you to get so tight, man. We keep in touch, and it's really a privilege to be able to come up and come into your practice. And I appreciate everything that you do.
And I appreciate you very much. And I love what you're doing. I think you're doing great things, and it's great that you're spreading the word now with this medium. So congratulations to you.
Thank you. And we're going to have to get you back on soon to cover some more topics.
I appreciate it.
Thanks again.
Thank you.
Awesome.
The views, information, or opinions expressed in the series are solely those of the individuals involved and do not necessarily represent those of Chip and Joanna Gaines, Binel Audio, nor Magnolia.